Okay, so this is the American Society of Plastic Surgeons consent. I think it's very useful because it outlines a lot of things that you should know before you sign up for an elective surgery. So I'm going to read it to you and explain it as we go through it. So hopefully it makes more sense. All right, so instructions. This is an informed consent document that has been prepared to help inform you about surgery, its risks, as well as alternative treatments. It is important that you read this information carefully and completely. Please initial each page indicating that you have read the page and sign the consent for surgery as proposed by your plastic surgeon and agreed upon by you. Alternative treatments. Risks and potential complications are also associated with alternative surgical forms of treatment. So depending on what you're having done, we will have discussed alternative treatments. If we did not, please ask about it. And so I'm not going to belabor that point right now. Inherent risks of surgery. Every surgical procedure involves a certain amount of risk, and it is important that you understand these risks and the possible complications associated with them. In addition, every procedure has limitations. An individual's choice to undergo a surgical procedure is based on the comparison of the risk to potential benefit. Although the majority of patients do not experience these complications, you should discuss each of them with your plastic surgeon to make sure you understand all possible consequences. So I want to start off by explaining that, I guess, point number one is our goal is your goal. We want you to have the best possible result and outcome with the easiest recovery possible and the lowest possible risk of complications. So our goals are 100% aligned with your goals. Now, when we talk about these complications, I want to emphasize that complications are rare and tragic, oh my God, I wish I hadn't had this surgery level complications are even more rare. So basically what we do to minimize the risk for complications is we try and control everything that we can possibly control. So from the decision making to preparing for surgery, during surgery, after surgery, we try to control everything we can to give you the best result with the easiest recovery and the lowest risk of complications. But there is no possible way that we can make that risk for complications zero. And so that's why it's very important that you understand the possible risks of surgery before you decide to go through with it. So the factors out of our control include things like diabetes, high blood pressure, being around nicotine, obesity, poor blood flow, vascular disease, a recent history of chemotherapy, being a recent history of having cancer. There's all kinds of variables that we can't control. We can't control how you heal. We can't control how well you follow our instructions before, during, and after surgery. I guess during surgery, there's no instructions for you to follow because you're asleep. But you know what I mean. We can't control how you behave or what you do before or after surgery. That's completely on you. And we can't control how your body heals. We can't control what underlying diseases or disorders you might have. And so there's always a level of risk involved with any procedure. And the more invasive and involved the procedure is, the higher the risk for complications. And the more medical comorbidities that you have, the higher the risk for complications. In other words, if you have diabetes and you're obese and you have lung disease, you're at extremely high risk for complications. Throw in kidney failure and the risk for complications goes up dramatically. If you are a healthy 20-year-old with no medical problems, your risk for complications is quite low. So a lot of it depends on your body and where we start. Basically, what your body and how well we expect it to heal. All right, so moving on from the inherent risk of surgery. So let's move down and kind of talk about each one of these in more detail. So in thinking about the risk of surgery, the reason I really want you to understand all of this is because it's really important for you to understand these risks in your decision making to have the surgery. Because, the pros or the reason to have plastic surgery is because it will hopefully make you look better, feel better, and be more confident. The cons to having plastic surgery are you're spending money, you're taking time off of work to recover, and you're accepting the risk for a complication. Those are the three cons or downsides that you have to accept. And so the benefit of looking better, feeling better, and being more confident needs to win when you compare it to the downsides, which are the money you're spending, the time you spend recovering, and the risks you take or accept of a complication. Now, on that same note, I will tell you that I've had plastic surgery done. I've had liposuction. I get Botox. I get lasers done on my face. I'm not ashamed to admit that I have these procedures done, and I know that I accept a risk whenever I do these things, but that I know that the benefits far outweigh the risk. My wife's had plastic surgery procedures done. Same thing. The benefits outweigh the downsides and the risks. And I also, plastic surgery is most of my life. It's what I do all day, almost every day. It's what I've spent the most of my adult life studying and being involved with. And if I offer you a procedure, that means that the benefits outweigh the risks from what I know and what I can tell. If I thought the risks far outweighed the benefits, I wouldn't even agree to do the surgery on you. So if you're at this point of reviewing the consent, you've most likely proceeded with having a surgery done, which means we've offered you the procedure, which means that we believe that the benefits outweigh the risks. The reason that these consent forms are important is because it helps you understand the risk side of things so you can make sure that you still want to go through with it. It would be unethical for us to proceed with surgery if you felt that once you were informed about the risks, it was no longer worth it for you. And informed consent and making sure you understand these things is very gray. Because there's really no way you can understand what's involved and the risks involved like I can, because I'm the plastic surgeon. That's why you're seeing me to have this procedure done and trusting me to take care of you. And so I don't expect you to understand things on the level that I understand things. But I want to make sure you understand the risks of the surgery enough that you're making an informed decision to proceed with it. All right, that's enough of my editorial. Let's keep going on down the list here. All right, seroma. So seroma, fluid may accumulate between the skin and the underlying tissues following surgery, trauma, or vigorous exercise, which is referred to as a seroma. You may notice localized swelling or shape change that should alert you that a seroma may have occurred in your postoperative period. Seromas should be addressed to prevent an unfavorable outcome. Should this problem occur, notify your surgeon and additional procedures for drainage of fluid may be required. All right, so basically seroma is just empty space. I call it a potential space where your body hasn't healed yet and fluid has filled up and is just hanging out. Now, what we do to prevent seromas is we put in drains. If that area of the body is at high risk for developing a seroma, we put in drains and we have you wear a compression garment. Those are really the two maneuvers to help prevent a seroma. The other thing would be eating a lot of protein so you can heal as fast as possible. Now, if you develop a seroma, which would be a fluid collection between layers of tissue, we would start by aspirating it. So we would stick a needle in and suck out the fluid every few days to keep it empty. The reason it's important to keep the seroma empty is that we need those tissue layers to kiss and be opposed so that they can heal. And once those tissue layers heal, then you don't have to worry about the seroma anymore. So a seroma is basically a collection of fluid that is preventing tissue layers from sticking together. And so we need to get that fluid out so that they can heal so you don't have to worry about the seroma. So we start by aspirating it with a needle. We usually will stick the needle in an area where you're numb from the surgery. We'll suck it out. We want to do this a couple times a week to keep that area evacuated so your body can heal. We'll then have you work compression over that area to get those tissue layers to stick together and heal. Keep eating protein and being healthy, and eventually the seroma will go away. If aspirating it doesn't work, we may need to put a drain in and get it to drain. And usually we can just numb you up and put a new drain in to drain that area. Bleeding. It is possible, though unusual, to experience a bleeding episode during or after surgery. Should postoperative bleeding occur, it may require emergency treatment to drain accumulated blood, or you may require a blood transfusion. Though such occurrences are rare, the collection of blood that can occur under your skin following surgery is referred to as a hematoma. Increased activity too soon after surgery can lead to increased chance of bleeding and additional surgery. It is important to follow postoperative instructions and limit exercise and strenuous activity for the instructed time. Non-prescription herbs and dietary supplements can increase the risk of surgical bleeding. Hematoma can occur at any time, usually in the first 3 weeks following injury or surgery to the operative area. If blood transfusions are necessary to treat blood loss, there is a risk of blood-related infections such as hepatitis and HIV. Your surgeon may provide medications after your surgery to prevent blood clots. Medications that are used to prevent blood clots in veins can produce bleeding and decrease blood platelets. All right, so let's break this down. Basically, during surgery, I'm going to stop all of your bleeding. That is part of doing the surgery correctly. So I will not close your skin, and the surgery will not end if you're bleeding. It would be extremely unlikely in a plastic surgery procedure to lose so much blood during surgery that you need a blood transfusion. If you need a blood transfusion, we will give you one if it's what you need, unless you're a Jehovah's Witness and you tell us that under no circumstances do you want blood, then we will not. If you do need blood, we will only give it to you if you absolutely need it. I'm not going to give anybody blood that doesn't really need it. But anyways, that would be highly unlikely in a plastic surgery procedure to need a blood transfusion. But if you do need it and it's going to help you, we will do it. And also, in addition to that, the risk of getting hepatitis and HIV from blood transfusions in 2019 is extremely low. The way that the blood banks are run and the way blood is tested, it is extremely, extremely low that you would get a bloodborne illness such as that. But it has to be disclosed. So the bigger points I want to touch on in this paragraph are that, I'm not going to end your surgery and I'm not going to finish the surgery while you're bleeding. We stop bleeding during surgery and we don't sew you up and end the surgery if you're bleeding. If you do too much too soon, you could cause bleeding. The way we stop most blood vessels during surgery is with the Bovie. It's an electrical device that cauterizes the blood vessels, which prevents them from bleeding. Now, if you decide to go hit the gym the day after surgery or have sex the day after surgery, you're going to increase your blood pressure, you're going to increase your heart rate, and you're going to increase your risk for bleeding, which would be hematoma. So that's why it's so important for that first week after surgery to just take it easy. Don't exercise, don't have sex. Take your medications so your pain's under control. We want to do everything we can to keep you chill and comfortable because it will decrease your likelihood of bleeding after surgery. Other things are don't take ibuprofen for 72 hours. Wait a few days before you start taking ibuprofen because that can make you bleed. And do not take ibuprofen before surgery. Before surgery, I want you to quit taking aspirin, ibuprofen, all NSAIDs for at least 7 days beforehand. I want you to quit taking other medications like Plavix and medications like warfarin, Coumadin, Plavix that really make you bleed. We will tell you when to stop, and we're usually working with your cardiologist under those circumstances to tell you when to stop those medications. Herbs sometimes can make you bleed, so just disclose to us everything that you're taking, and quit taking all the herbs a month before surgery because they can have really long-lasting effects. If you need to take some herb all the way up till surgery, just let us know what it is so we can make sure it's not going to increase your risk of bleeding. What else? Oh, if you're at high risk for blood clots. So we're going to touch on that when we get down to the DVT section, so I'm not going to talk about it now. But the medications we use to prevent blood clots obviously are going to make you more likely to bleed and get a hematoma, but I'm going to talk about that in another section. Infection. Infection, although uncommon, can occur after surgery. Should an infection occur, additional treatment including antibiotics, hospitalization, or additional surgery may be necessary. It is important to tell your surgeon of any other infections, such as a history of MRSA infections, an open wound, recent upper respiratory infection, pneumonia, ingrown toenail, insect bite, tooth abscess, or urinary tract infection. Infections in other part of the body may lead to an infection in the operated area. Postoperative infections often result in more extensive scarring and predispose to revision surgery. So things that we're going to do to help minimize your risk of infection is we're going to have you shower with Hibiclins before surgery to decrease the amount of bacteria living on your skin. We're going to give you antibiotics before and during surgery, and we're going to give you antibiotics to take after surgery. Also, in addition to that, of course, whenever we're doing surgery or procedure, the instrumentation and all the supplies are sterile that need to be sterile. So sterile technique is a given. But otherwise, we're going to do everything we can to minimize your risk for infection. So what you can do is stay healthy, avoid sick people, and follow our postoperative instructions. And should you get an infection, we will take care of you. We may add or increase your oral antibiotics. We may need to admit you to the hospital and give you IV antibiotics. In worst case scenario, you may need an additional surgery. Ileus, the return of bowel function following surgery is important, and ileus are disruptions in bowel function caused by the failure of peristalsis or hypomobility of your bowels/gut, resulting in a lack of defecation and possibly repeated vomiting. Medications like pain medications, such as oxycodone, given you at the time of surgery, can contribute to the development of an ileus in the postoperative period. An ileus can result in abdominal distension, vomiting, inability to absorb oral medications, and possibly hospitalization. Repeated vomiting could result in aspiration pneumonia and respiratory failure. It can be essential to have regular bowel function after whatever procedure we did. So let's break this down a little bit. In general, we want your bowels to keep working. It is unlikely in any of the plastic surgery procedures that you would be having done that we would be manipulating your bowels. The only time I actually manipulate bowels is if we're doing an abdominal wall reconstruction or transplanting part of the bowels somewhere else, such as for esophageal reconstruction or lymph node transfer. But in most cases, you can eat as soon as you wake up from surgery and you feel like eating. Ileus is very unlikely. What you can do to prevent an ileus is stay hydrated, take your vitamins, and minimize the amount of oxycodone or narcotics that you use. And take stool softeners. That'll also help too. If you tend to be constipated in general, start taking stool softeners weeks before surgery. Otherwise, take your stool softeners as we direct you to help prevent constipation. Healing issues. Certain medical conditions, dietary supplements, and medications may delay and interfere with healing. Patients with massive weight loss may have a healing delay that could result in the incisions coming apart, which is called a partial wound dehiscence, infection, and tissue changes resulting in the need for additional medical care, surgery, and prolonged hospitalizations. Patients with diabetes or those taking medications such as steroids on an extended basis may have prolonged healing issues. If you are taking steroids on a prolonged basis, please tell us. We will add vitamin A to your medications, which can help block or undo the effect that steroids have on healing. Smoking will cause a delay in the healing process, often resulting in the need for additional surgery. There's nothing worse you can do before, during, or after surgery than smoke. There are general risks associated with healing, such as swelling, bleeding, possibility of additional surgery, prolonged recovery, color changes, shape changes, infection, not meeting patient goals and expectations, and added expense to the patient. There may also be a longer recovery due to the length of surgery and anesthesia. Patients with significant skin laxity, such as patients seeking facelift, breast lifts, abdominoplasty, and body lifts, will continue to have the same lax skin after surgery. The quality or elasticity of skin will not change, and recurrence of skin looseness will occur at some time in the future, quicker for some than others. There are nerve endings that may become involved with healing scars from surgery, such as suction-assisted lipectomy, abdominoplasty, facelifts, body lifts, and extremity surgery. While there may not be a major nerve injury, the small nerve endings during the healing period may become too active, producing a painful or oversensitive area due to the small sensory nerve involved with scar tissue. Often massage and early non-surgical intervention resolves this. It is important to discuss post-surgical pain with your surgeon. All right, so let's talk about this. When it comes to healing, if you have diabetes, it's important that your hemoglobin A1C is low and that your blood sugar is well controlled. If it is not, we will not perform elective surgery on you. If you can get it controlled, we will perform elective surgery on you, but it's really important that you maintain that control during the early healing phase, because having high blood sugars really will impede your ability to heal. If you're on chronic corticosteroids such as prednisone, we'll add vitamin A and see if we can't reduce that dose some during the early healing phase, but we also need to be careful of adrenal suppression that may have occurred, so we will also need to give you stress dose steroids as well. So just be honest with us regarding all the medications you're taking. Smoking or nicotine use, I don't care how you're getting your nicotine, smoking, vaping, patches, gum, chew, whatever, it's the nicotine that causes all the problems with healing. So nothing's going to screw up your ability to heal and hurt your skin more than having nicotine in your system while your skin is trying to heal. So absolutely quit using all nicotine. I say 4 weeks before surgery, but we'll test your urine, and as long as your urine is negative, it's out of your system. Just don't use any more. What else? Stay hydrated. In other words, I think keeping your tissues perfused is super important for healing, and staying well hydrated will help the perfusion to those tissues. And then follow our postoperative instructions specific to each procedure. It will also help. Let's see, what else did I want to touch on? Skin laxity, this is true. So, we will get your skin as tight as we safely can during these procedures, but your skin sometimes just stretches back out. So we can't control the elasticity of your skin. The quality of your skin does not change from these surgeries. We are simply removing the extra skin, making the remaining skin tighter, but that doesn't change how stretchy it is or elastic it is. And then, there's going to be some nerves that are involved with surgery, cut, bruised, irritated, what have you. And so that's normal to have some pain after surgery. We're going to treat your pain. If you have unusual painful areas, massage and time are the most important things. And just keep us informed about what's going on, because we may have an intervention. Now, important nerves, we call them named nerves. Now, we know where those are and we're going to avoid them. But since you can feel your whole body, there are small sensory nerves that are probably going to be involved in some aspect with whatever procedure you're having done. And there's just no way to avoid that, because there are small sensory nerve branches everywhere in our body. Skin loss. Partial or full thickness skin loss or tissue necrosis can occur following a procedure. This can be most common in what are referred to as watershed areas, where blood flow or where blood perfusion can be less than optimal. Medical conditions and medications can also compromise blood flow. Should you develop tissue necrosis or skin loss, additional surgery procedures are likely to be required for debridement and to close the wound. Once healed, revisional surgery may be required. So again, this comes down to maintaining blood flow. So with many plastic surgery procedures, we're manipulating your tissue. And in manipulating your tissue, we're going to decrease the blood flow to that tissue. Now, normally it's not decreased enough to kill that tissue or cause necrosis. Necrosis means death, so death of the tissue. But if you don't follow our postoperative instructions, there's too much pressure on the tissue, you're around nicotine, you're not well hydrated, all these things can decrease the perfusion or blood flow to that area and can cause necrosis. So again, avoid nicotine, stay hydrated, follow our instructions, and your risk for having the skin die or tissue necrosis will be low. Delayed healing, wound disruption, or delayed wound healing is possible. Some areas of the skin may not heal normally and may take a long time to heal. Areas of skin may die. This may require frequent dressing changes or further surgery to remove the non-healed tissue. Individuals who have decreased blood supply to tissue from past surgery or radiation therapy may be at increased risk for wound healing and poor surgical outcome. Smokers have the greatest risk of wound healing complications. So again, it comes down to things above. Stay hydrated, avoid nicotine, and follow our instructions. Can all help optimize blood flow, which will optimize healing and minimize the chance of the skin dehiscing. Major wound separation. Wounds may separate after surgery. Should this occur, additional treatment, including surgery and even hospitalization, may be necessary. So, to break it down, healing issues, skin loss, delayed healing, skin necrosis, wound separation, they all fall under the same category. And at some level, they're basically all due to not enough blood flow to that skin edge. As long as there's enough blood flow or adequate blood flow to the skin edge, it will heal. So it's super important to do everything you can to keep blood flowing to those skin edges and to eat protein so you have the building blocks to heal. Scarring. All surgery leaves scars, some more visible than others. Although good wound healing after surgical procedure is expected, most surgeries will result in scars. So what I'm referencing right now, or what I'm reading, says this surgery will result in long, prominent scars that are permanent. Abnormal scars may occur within the skin and deeper tissues. Scars may be unattractive and of different color than the surrounding skin tone. Scar appearance may also vary within the same scar. Scars may be asymmetrical. There is a possibility of visible marks in the skin from sutures. These scars may become raised, red, or discolored in the first few weeks, months, but usually settle down over time. However, some patients are prone to hypertrophic or keloid scars, prominent raised red scars that do not settle. Further treatments with medication and or surgery may be required. Okay, so depending on what you're having done, you should have a good understanding of where your scars will be, and if you do not, please ask us. So basically what this is explaining is that anytime you make a skin incision, you have a scar, and scars are permanent. So what we do is we do everything we can to make the scar heal as nicely as possible. We also do everything we can to minimize the scars that you need, and we also do everything we can to conceal or place the scars in a good or hidden, less apparent location. So that's sort of everything we do. Get it to heal well, try and hide it, and minimize the length and amount of scars that you need. In addition to that, follow our instructions. We treat our scars differently on the face than on the body. And I have another video about what you can do to make your scars look as good as possible. We'll also laser the scars around 6 weeks after surgery to help them fade faster. But in general, time is always the best thing for scars. Time makes all scars fade. And if you start developing hypertrophic or keloid scars, then we will inject them with medications. And worst case scenario, excise them and do a scar revision. If you're having a scar revision, and that's the purpose of the procedure, the biggest risk would be that the future scar looks worse than the old scar, because time is on the old scar's side. The new scar is a fresh new scar that has to mature. So that's the biggest risk of a scar revision. But if you're being offered a scar revision, therefore we believe that the benefits outweigh the risk. Firmness, excessive firmness can occur after surgery due to internal scarring. The occurrence of this is not predictable. Additional treatment, including surgery, may be necessary. So, part of the healing process, things swell and your body generates scar tissue, and that can make things feel firm. This is especially common after liposuction and after a neck lift or the neck lift part of a facelift. That tissue becomes very firm, and with time it usually softens up. I described the feeling of your tissue after liposuction to it feels like cardboard. All right, fat necrosis. Fatty tissue found deep in the skin might die. This may produce areas of firmness within the skin. Additional surgery to remove areas of fat necrosis may be necessary. There is a possibility of contour irregularities in the skin that may result from fat necrosis. So fat necrosis is pretty rare. Essentially what it is it's pieces of fat underneath the skin that died and then they turn hard. Sometimes it dissolves away and it can leave a little dent in the skin. Sometimes it gets hard and so it can feel hard, and oftentimes you can't see it but you can feel it. Regardless, if it happens, we may need to do surgery to remove the fat necrosis, and then I would need to do some fat grafting and other maneuvers to make it look normal again. But that's what fat necrosis is. The most common time that we see fat necrosis is when we're doing free flaps, so we're transplanting tissue from one area to another, and there's areas of fat within that transplanted tissue that don't get enough blood flow from the blood vessels that remain or are hooked up, and so those little areas of fat can die. Think of it as a couple grapes on the vine that don't have enough blood flow, so they die, so we have to remove those grapes. Revision surgery. Every effort is made for you to have a favorable outcome, but unforeseen events can occur that may require revisional surgery. Patients with multiple medical problems, massive weight loss, smokers, patients that develop infections, and other high-risk patients have a greater propensity or likelihood of requiring revisional surgeries. Issues that could need to be addressed in the postoperative period include, but are not limited to, dog ears, asymmetry, contour irregularities, folds, wrinkles, loose skin, umbilical malposition or umbilical loss, and pubic distortion. So again, we will do everything we can to give you the best possible result with the lowest risk of complications, but there are things we can't control, and we can't control how you heal. We can't control what you do during your postoperative recovery period, and so should you need a revision procedure, we'll take care of you, but it's possible that you may need a revision. And that's basically what this is explaining. Just less than ideal result may need a tweak to get it better, because both you and we want you to have the best possible result, and sometimes we need to do a little tweaking after you heal or during the healing phase to get you there. One thing I wanted to mention about scarring that I forgot to mention is, we're going to do everything we can to make your scars look as good as we can, but we just can't control how you heal. Some people make hypertrophic scars, some people make keloids, and that is just something that is out of our control. Let's see. Venous thrombosis, clot, and sequelae. Thrombosed veins, which resemble cords, occasionally develop around IV sites and usually resolve without medical or surgical treatment. General anesthesia and surgery can be associated with an increased risk for deep venous thrombosis, which is what a DVT is, and pulmonary embolus, PE. Often, a screening process is conducted to determine if you are at increased risk for a DVT/PE. Measures can be taken at the time of your procedure to prevent such events from occurring. It is important to discuss with your surgeon if you or your family have a history of DVT/PE, certain high estrogen pills, obesity, history of cancer, history of inflammatory bowel disease, etc. may increase your risk of thrombosed veins and the development of a DVT/PE. So, a venous thromboembolism refers to a deep venous thrombosis, which usually occurs in the leg and thigh veins. That blood clot breaks loose and travels to the lungs and becomes a pulmonary embolism. That is scary, and so we do everything we can to minimize the risk of that happening. So something that everybody gets is everybody gets scored on this Caprini scale that tells us what your risk is for developing a DVT or PE. If you are high risk, we're going to put you on Lovenox shots after surgery to help thin your blood and reduce your risk of getting a DVT or a pulmonary embolism. The reason we don't give Lovenox shots to everybody is because it also increases your risk of bleeding or a hematoma. So what the scoring system tells us is that you're at high enough risk that it's worth accepting the risk of a hematoma to help prevent or reduce your risk of a DVT or a PE. So everyone gets that scoring system done, and if you were high risk, you would have been prescribed Lovenox. One side note, if you're an out-of-town patient and you're flying home, I want to prescribe you a Lovenox shot to take before you fly. No matter what your Caprini score is or what level of risk you are, if you're going to be flying anytime close to surgery or general anesthesia, I want you to take a Lovenox shot before you get on a plane. If you're not going to sleep and it's a local anesthesia procedure, then your risk of a DVT or PE is really no different than just being alive like you are right now. Where DVT, PE risk goes up is when you go to sleep under general anesthesia, and procedures like tummy tucks that tighten your abdominal wall also can contribute to your risk. So we'll run you through our risk calculator, which is the Caprini score, and then if you're high risk, we'll put you on Lovenox. And if you are low risk, it's not worth the risk of bleeding. So about DVT and pulmonary embolism again. So knock on wood, I've never had anybody die during surgery or from surgery or after surgery, anything like that. But this is what scares me the most, is DVT and PE. And so that's why we're super vigilant about making sure that if you're high risk, you are on Lovenox. And for everybody, what we do is we put sequential compression devices, which are SCDs, on your legs before surgery, and they're on during surgery the entire time. We'll also put you in compression stockings or compression hose after surgery if you're going home. And I want you walking around as soon as possible, which will also help reduce your risk of a PE. And those are sort of the main things. Basically, keeping your legs squeezed and moving is the key to preventing a DVT or a pulmonary embolism. I have had patients who, a couple patients that did develop a pulmonary embolism after surgery, and they came to me and they were short of breath after surgery. So immediately on the top of my list was that they had a pulmonary embolism. So we worked them up for it, and they did indeed have it. And so what they had to do was be placed on blood thinners for months, and I have the pulmonologist manage that. So again, it's really rare that you would get a DVT or PE, and if you do get it, it is unlikely to kill you. So it's one thing to get a DVT. That probably happens more than we think. It's just not everybody gets an ultrasound to look for it. Pulmonary embolism probably happens more than we think, but a lot of people probably don't have symptoms. So the people we find out about it, or that we confirm that have a pulmonary embolism, are the people that are symptomatic. And so usually if that happens, again, it's not a big enough clot to kill you, but it is possible. And so that's why it is definitely something that we're always thinking about, and we do everything we can to minimize your risk. Cardiac and pulmonary complications. Pulmonary complications may occur secondary to blood clots, pulmonary emboli, fat deposits, fat emboli, pneumonia, or partial collapse of the lungs after general anesthesia. Pulmonary emboli can be life-threatening or fatal in some circumstances. Inactivity and other conditions may increase the incidence of blood clots traveling to the lungs, causing a major blood clot that may result in death. It is important to discuss with your physician any past history of swelling in your legs or blood clots that may contribute to this condition. Cardiac complications are a risk with any surgery and anesthesia, even in patients without symptoms. If you experience shortness of breath, chest pain, or unusual heartbeats, seek medical attention immediately. Should any of these complications occur, you may require hospitalization and additional treatment. So I kind of mentioned some of this. Again, we're always worried about blood clots. Generally, they occur in your leg and they travel to your lung, which is what causes the problem. So we're doing everything we can to prevent that and minimize your risk of that happening. Should you have shortness of breath, chest pain, anything like that after surgery, call me, call us, 850-500-7527, and also call 911. If you're really short of breath, you need to call 911 and or go straight to the ER. But keep us in the loop and let us know right away as well. Let's see. Other things, fat emboli, what that is it's the same concept. So with a pulmonary emboli, blood clots, it's a blood clot that travels to the lungs and blocks blood flow to the lungs or to a portion of the lungs. The same thing, a fat cell in the blood can do the same thing. So if you're having liposuction, it's highly unlikely to get a fat embolism. If you're having fat grafting, fat injected into your butt or somewhere else, then it is theoretically possible that you could get fat into the veins, into the blood vessels, and that it could travel around your body as a fat embolism and eventually block blood flow to the lungs or somewhere else. Now, that's really rare. As far as I know, it's never happened to anyone. Fat embolism, the way that anyone that I've operated on, I know it's happened to people. The way that we try and minimize the risk of fat embolism is we use blunt cannulas, so they're not sharp, so they're unlikely to go into a blood vessel. I mean really blunt cannulas, and we inject under very low pressure when we're injecting fat, again, to minimize the risk that the fat would get into a blood vessel. But it is theoretically possible that the fat cells and chunks of fat could travel through your blood vessels and block blood flow to something. Possible hernia repair. At the time of your procedure, your surgeon may identify a hernia. Incision of the groin umbilical, it is in your best interest that the hernia be repaired. If we see a hernia during surgery, we will fix it. Skin sensitivity. Itching, tenderness, or exaggerated responses to hot or cold temperatures may occur after surgery. Usually this resolves during healing, but in rare situations it may be chronic. So again, this is out of our control. Some people's skin and tissues become more sensitive after surgery. Some people's skin becomes less sensitive after surgery. What I find is that with time, it seems to normalize. So if you're more sensitive with time, it seems to become less sensitive. And if you're a little bit numb with time, it seems to become more normal. Sutures. Most surgical techniques use deep sutures. You may notice these sutures after your surgery. Sutures may spontaneously poke through your skin, become visible, or produce irritation that requires suture removal. So the sutures we use deep are generally dissolving sutures. These are clear or a little bit purple in color. They should dissolve, so hopefully you don't see them. If they spit out a little bit, we can trim them. You can trim them. We can cut them out. We will take care of that should it happen, but that's what that is. It's nothing major. Superficial or sutures on the surface of the skin that we use are normally black. It's normally what's called a nylon suture. Those sutures eventually need to be cut out. On your face, we like to cut those sutures out at 5 to 7 days. On your body, we might wait a little longer, 10 to 14 days, depending on the situation. But that is basically sutures. Damage to deeper structures. There is the potential for injury to deeper structures, including nerves, blood vessels, lymphatics, muscles, and lungs during any surgical procedure. The potential for this to occur varies according to the type of procedure being performed. Injury to deeper structures may be temporary or permanent. So this is really scary. Basically, it's saying that it's theoretically possible that, deeper structures could be injured during surgery. Now, your surgeons know where these structures are, and the surgeries are designed to avoid injuring any of them. But, theoretically, it is possible that these could be injured as part of the surgery because they are close by. But that's sort of what this is saying. It's saying, yep, they're close by and it's possible they could be injured. Full disclosure, yes, it is possible, but it's highly unlikely given your surgeons know their anatomy and know where these things are. Surgical anesthesia. Both local and general anesthesia involves risk. There is the possibility of complications, injury, and even death from all forms of surgical anesthesia or sedation. So, again, it comes down to being completely honest with us regarding any allergies you may have, reactions to medications you may have, and any and all medications or drugs you're using. I'm talking herbs, street drugs. I don't care what it is, just tell us. We're not going to, report you to the police or anything. We just need to know everything that you're putting in your body so we can make sure that we get you through your procedure as safely as possible. Shock. In rare circumstances, your surgical procedure can cause severe trauma, particularly when multiple or extensive procedures are performed, although serious complications are infrequent, infections or excessive fluid loss can lead to severe illness and even death. If surgical shock occurs, hospitalization and additional treatment would be necessary. Okay, this is really rare in plastic surgery. It's more common in trauma surgery or vascular surgery. It's really rare in plastic surgery. We're usually not dealing with giant blood vessels that could cause you to go into a hemorrhagic shock. So it has to be listed on this as a possibility, but again, it's extremely rare. If you do go into shock during surgery, we're going to take care of you. We're going to stop the bleeding. We're going to give you blood. We're going to do everything we can to make sure you're okay. So it is a risk of any procedure, although in most plastic surgery procedures, this is very unlikely because we're not operating on the heart, the lungs, or big blood vessels. Pain. You will experience pain after surgery. Pain of varying intensity and duration may occur and persist after surgery. If you are a chronic pain patient followed by a pain therapy practitioner, you may be asked to see this practitioner preoperatively to assist you in the management of your pain disorder in the postoperative period. Chronic pain may occur very infrequently from nerves becoming trapped in scar tissue or due to tissue stretching. There are nerve endings that may become involved with healing scars from surgery. While there may not be a major nerve injury, the small nerve endings during the healing period may become active, producing a painful or oversensitive area due to the small sensory nerve involved with scar tissue. Massage and early surgical intervention usually resolve this. It's important to discuss this with your surgeon. So, we're going to treat your pain. So there's a few things we're going to do. Let's see. Before surgery, we may and likely gave you, depending on what you're having done and where you're having it done, pills to take. That would be the Tylenol, gabapentin, and Celebrex. So take those before surgery if we prescribed them. That will help minimize your pain after surgery. Other things we'll do is during surgery, we're going to inject numbing medicine, again, to help keep you comfortable after surgery when you wake up. And finally, we will prescribe you medications to take after surgery to help keep you comfortable. We want you to be comfortable. You heal better when you're comfortable. Everything is better when you're comfortable. But we can't give you so much pain medicine that you're asleep and you're not breathing. So we have to keep you awake and responsive and breathing. And if you're awake and responsive and breathing, you're going to have to tolerate and endure some pain. But we will do everything we safely can do to help treat your pain after surgery. And I have another podcast. I have another video that explains your medications after surgery. So reference that. And again, if you're taking the medications as prescribed and following our instructions and you're still in pain, call us so we can help figure out what we can do to help get you comfortable. And most importantly, rule out any thing that could be wrong that would be causing your pain that we would need to fix. Allergic reactions. In rare cases, local allergies to tape, suture material, ink glues, blood products, topical preparations, or injected agents have been reported. Serious systemic reactions, including shock, may occur in response to drugs used during surgery and prescription medicines. Allergic reactions may require additional treatment. It is important to notify your physician of any previous allergic reactions. Okay, so again, be honest with us. Make sure you disclose all of your allergies so we know. In addition to that, there's no way we can predict what you might be allergic to that you don't know you're allergic to. And so if you have an allergic reaction, we will take care of you. If it's something simple like tape or suture material or glue, it usually just requires some basically nursing type care in our clinic to get it fixed up. If you have a serious systemic reaction such as shock, we will take care of you. We will give you epinephrine and whatever it takes to take care of you should that happen. And this is just explaining that it is possible that you could be allergic to something and react to it and you don't know you're allergic to it yet. Drug reactions, unexpected drug allergies, lack of proper response to medication, or illness caused by the prescribed drug are possibilities. It is important for you to inform your physician of any problems you have had with any medication or allergies to medications prescribed or over the counter, as well as medications you now regularly take. Provide your surgeon with a list of medications and supplements you're currently taking. Again, be honest with us. We want to know everything you're putting in your body. all prescribed medications, over-the-counter medications, herbs, supplements, illicit drugs you like to do on the weekends, everything. Just lay it all out there so we know what you're taking, and please tell us any unusual reactions or allergies you've had to medications as well. Surgical wetting solutions. There is a possibility that large volumes of fluid containing dilute local anesthetic drugs and epinephrine that is injected into fatty deposits during surgery may contribute to fluid overload or systemic reaction to these medications. Additional treatment, including hospitalization, may be necessary. Okay, so in lots of the surgeries we perform, we use a tumescent. The tumescent includes saline and epinephrine to minimize bruising and bleeding. If you're awake, that tumescent also has numbing medicine in it. In general, we don't use so much that you would go into fluid overload, which is what this is referring to. So in general, I want you to focus on making sure you're drinking enough fluids. I want you peeing every 4 hours, and I want the urine not very yellow, fairly clear. I'm not super worried about you getting fluid overloaded. The only time I really worry about you getting fluid overloaded from surgical wetting solutions would be if you have renal or heart failure, in which case I probably would not be doing liposuction on you anyways. Fat air embolism. In rare cases, fat particles or air can enter the vascular system and can travel to the heart, lungs, or brain. This can result in significant complications, including death. So I mentioned that above when we were discussing blood embolism or blood clot embolism, which is a venous thromboembolism, as well as a fat embolism. So again, this is extremely rare. As far as I know, no patients I've ever operated on have had a fat or air embolism, but it is theoretically possible. We do everything we can to minimize this risk by using large blunt cannulas when we inject fat, and we do it under very low pressure. Persistent swelling, lymphedema. This can occur following surgery because lymphatics and lymph nodes could be injured from the surgery. Again, it's unlikely. This is most likely going to occur if you're having lymph nodes removed for cancer. Unsatisfactory result. Although good results are expected, there is no guarantee or warranty expressed or implied on the results that may be obtained. The body is not symmetric, and almost everyone has some degree of unevenness which may not be recognized in advance. One side of the face may be slightly larger, one side of the face droopier. The breast and trunk area exhibits the same possibilities. Many of such issues cannot be fully corrected with surgery. The more realistic your expectations as to results, the better your results will appear to you. Some patients never achieve their desired goals or results at no fault of the surgeon or surgery. You may be disappointed with the results of your surgery. Asymmetry, unanticipated shape and size, loss of function, wound disruption, poor healing, and loss of sensation may occur after surgery. Size may be incorrect. Unsatisfactory surgical scar location or appearance may occur. It may be necessary to perform additional surgery to improve your results. Unsatisfactory results may not improve with each additional treatment. Okay, so this is an important thing to understand. So I want to reiterate that your goal is the same as our goals. We want you to have the best possible result with the easiest, most uneventful recovery and no complications. So we're going to do everything we can to give you the best possible result and no complications. Everything we do is built around providing that service to you. However, there is no way that we can guarantee or warranty the surgery. And the reason for that is that the human body is not perfect. It doesn't start perfect. It doesn't heal perfectly. And we can't control that. And that's basically what this is explaining. So there's two quotes that I live by, and I kind of think about every day. And one of them, it sounds better in Latin, but in English it means and translates to always striving for perfection, never quite achieving it. And what that reminds me of is that the pursuit of a perfect result is a worthy goal, and it's worth trying to achieve every single time, but it's not actually ever completely possible. Again, because nobody starts out perfect, and the human body's not perfect, and nobody necessarily heals perfectly. And so there's just too many variables to actually generate a perfect result. Even when people say that the result's perfect and they say, Dr. Brown, this is perfect. I'm so happy it's perfect. If I zoom in enough on my photographs, I can always find something that's not perfect. So the point is we try to give you the best possible result, but perfection is not possible. And symmetry is not possible. We will try and make you symmetric in every way, but you don't start out symmetric, and so it's impossible to make you perfectly symmetric. And so the biggest point of this paragraph is to remind you that we can't guarantee or warranty anything, and so if you need a revision, if it's a reasonable revision and you're a surgeon, if I'm your surgeon and I agree, yeah, you know what, I don't like that either, let's fix it, I'm not going to charge you for my time, but you will always be responsible for the cost of any devices, such as implants involved, the cost of any supplies, facility, anesthesia, anything like that. Because you have to understand that we are not an insurance company, and we can't control everything about how you heal. And so it's impossible for us to warranty or guarantee or insure you of a perfect result. Basically, you need to understand and know that we are doing everything we can to do that for you, but we can't promise it or guarantee it. And because of that, we can't function as an insurance company and pay for all costs associated with the revision should that be necessary. There are potential adverse reactions that occur as the result of taking over-the-counter herbal and or prescription medications. Aspirin and medications that contain aspirin interfere with forming blood clots and therefore may contribute to more bleeding issues. If you have a medical condition such as a heart arrhythmia, heart stent, blood vessel with blockages or blood clots, and are taking medications to thin your blood and prevent clotting such as Plavix, warfarin, Coumadin, Effient, or Pradaxa, discuss management of these medications around the time of surgery with your plastic surgeon. Your plastic surgeon may sometimes coordinate these medications with the doctor that prescribed them for your medical condition. If you have been prescribed drugs for a medical condition, do not stop them without discussing it first with your plastic surgeon. Stopping these medications abruptly may result in a heart attack, stroke, or death. Be sure to check with your physician about any drug interactions that may exist with medications which you are already taking. If you have an adverse reaction, stop the drugs immediately and call your plastic surgeon for further instructions. If the reaction is severe, go immediately to the nearest emergency room. When taking the prescribed pain medications after surgery, realize that they can affect your thought process and coordinations. Do not drive. Do not operate complex equipment. Do not make important decisions. Do not drink alcohol. Do not do any other drugs while taking these medications. Be sure to take your prescribed medication as directed. Okay, so again, this comes down to being honest with us. Tell us everything you're taking so we can coordinate adjusting your medications around surgery with any other doctors that need to be involved in the process, and follow our instructions with how you should take the medications we prescribe. Sun exposure, direct or tanning salon. The effects of sun are damaging to the skin. Exposing the treated areas to sun may result in increased scarring, color changes, and poor healing. Patients who tan, either outdoors or in a salon, should inform their surgeon and either delay treatment or avoid tanning until the surgeon says it is safe to resume. The damaging effect of sun exposure occurs even with the use of sunblock or clothing coverage. So, we live in Florida. It's impossible to avoid the sun completely, but what this is explaining is that fresh scars are very vulnerable to the sun, and ultraviolet radiation is bad for healing tissue. So while your scars are fresh and healing and cannot be covered with sunblock, just avoid the sun, wear clothing to block it. If it's your face, wear big hats and try not to go outside any more than you have to. Once your tissues have healed enough that you can use sunblock, then use sunblock, and make sure the sunblock has UVA and UVB protection. This is mostly important if we're lasering your face and you're doing a laser resurfacing of your face, and we have specific instructions and lotions and potions for you to use if that's what you're having done. Travel plans. Any surgery holds the risk of complications that may delay healing and your return to normal life. Please let the surgeon know of any travel plans, important commitments already scheduled or planned, or time demands that are important to you so that appropriate timing of surgery can occur. There are no guarantees that you will be able to resume activities in the desired time frame. Allow at least 10 to 14 days to travel via airplane. Medications may be required should you have a long flight to prevent DVT, PE in the immediate postoperative period. So yes, if you're flying within a month after surgery, let me know so we can decide whether or not you need a Lovenox shot to help reduce your risk of blood clots from being on an airplane. Otherwise, if you have big events coming up, just tell us when they are so we can make sure that we're planning your surgery or procedure appropriately. Weddings, family gatherings, reunions, big business meetings, events, conferences, things like that. Just let us know so we can make sure that you have adequate time to recover. Long-term results, subsequent alterations in the appearance of your body may occur as the result of aging, sun exposure, weight loss, weight gain, pregnancy, menopause, and other circumstances not related to surgery. So, if you gain a bunch of weight after your tummy tuck and liposuction, don't get mad at me when you have a beer belly or, your shape changes because you gained weight. If you have a breast augmentation and you get pregnant and your breasts change, again, don't get mad at me. We are here to help you, and we will do everything we can to, get you back to a place where you're confident and happy. But, there's things that happen in life that can change your result, and it has nothing to do with the surgery itself. Body piercing individuals who currently wear body piercing jewelry in the surgical region are advised that an infection could develop from this activity. Body piercing jewelry should be removed prior to surgical procedures. So, what I'm mostly concerned about is the bovie cautery, so the device that's used during surgery to do most of the surgery actually, because it cuts tissue and stops bleeding at the same time, uses an electrical current, and so metal piercings can interfere with that. And so we just need you to remove any and all body piercing and jewelry that you have before surgery. If it's hard to remove and replace, or it's not something you should remove, let us know. It may be okay depending on where it is, but just let us know. And if you can remove it, please remove it. Nails. To determine your vital status during surgery, your anesthesia provider may require access to your fingernails for monitoring. Make sure you have at least 2 fingernails free of nail polish or acrylic nails on the date of your surgery. So the monitoring device that measures oxygen in your blood as well as your pulse needs to be able to see through your fingernail to do that, and so we just need to make sure that you have at least 1 or 2 fingernails that monitoring device can be placed on. Jewelry should not be brought with you at the time of your surgical procedure. Items such as earrings, wedding rings, necklaces, etc. should be removed and placed in a safe place. Do not bring your jewelry with you for surgery. Yeah, please just take all your expensive jewelry off, keep it at home. It's just easier that way. Future pregnancy and breastfeeding. If your surgery could interfere with pregnancy or breastfeeding, we will let you know. And if you're planning on getting pregnant after surgery, please let us know so we can discuss this. Female patient information is important to inform your plastic surgeon. If you use birth control pills, estrogen, suspect you may be pregnant. Many medications, antibiotics may neutralize the preventative effect of birth control pills, allowing for contraception and pregnancy. So again, just disclose everything you take to us so we can make sure that everything is safe and we know everything we need to know to make this as safe of an experience as possible. But you should know that the medications that you may be given around surgery could interfere with the efficacy or the effectiveness of your birth control pills. So it's a good idea to use other methods of contraception for that cycle when the medications from surgery could have interfered with your birth control. And I can explain this on a more detailed level if it applies to you. Intimate relations after surgery. Surgery involves coagulating blood vessels, and increased activity of any kind may open these vessels, leading to a bleed or hematoma. Activity that increases your pulse or heart rate may cause additional bruising, swelling, and the need for return to surgery to control bleeding. It is wise to refrain from intimate physical activities until your physician says it is safe. Okay, so it comes down to the whole thing where I want you to take it easy for a week after surgery to minimize any bleeding inside. That means no sex, no exercise, and take your medications and keep your pain under control. We want to keep you as chill as possible for a week after surgery to help minimize the risk of any bleeding. After a week, you can have sex after a week unless you have a surgical site near your genitalia. What I mean by that is if there's a liposuction incision nearby, wait till we give you the okay. If you had a tummy tuck, you're going to have to wait longer than a week. Wait till we give you the okay. If you had a labiaplasty, you need to wait 2 months because your labia need to heal before you have sex. So, if you're having something done to your face and it's far away from your genitalia and it's completely unrelated, you can have sex after a week. If it's at all related to that area of your body, wait till we give you the okay. But in general, for the first week, after any surgery, do not have sex because we don't want your blood pressure high or your heart rate getting elevated. Mental health disorders and elective surgery. It is important that all patients seeking to undergo elective surgery have realistic expectations that focus on improvement rather than perfection. Complications or less than satisfactory results are sometimes unavoidable and may require additional surgery and are often stressful. Please openly discuss with your surgeon prior to surgery any history that you may have of significant emotional depression or mental health disorders. Although many individuals may benefit psychologically from the results of elective surgery, effects on mental health cannot be accurately predicted. So it comes back to telling us everything so we can help you make the most informed decision. I like to tell people that happiness is complicated and oftentimes unrelated to your results after surgery. So, of course, I want you to be happy after surgery. I want you to have a great result. But there's no way I can guarantee that will make you happy. So if you're having a breast augmentation to make your breasts larger, that's great. That's what a breast augmentation does. If you're having a facelift to make your face look younger, that's great. That's what a facelift does. If you're having a tummy tuck to make your abdomen flatter, that's great. That's what a tummy tuck does. But if you're having a surgery to, fix a marriage or get a job or some other extraneous, thing or result or outcome, that's not a good idea because there's no way that you can know or we can know if having a facelift is going to get you that job or save a marriage or things like that. So please tell us if that's your motivation for surgery so we can make sure that you're not having something done for the wrong reasons. And if you have a history of a mental health disorder, depression, anxiety, bipolar disorder, anything like that, please let us know, again, so we can help make the best decisions for you. Additional surgery, necessary reoperations. There are many variable conditions that may influence the long-term result of surgery. It is unknown how your tissue may respond or how wound healing will occur after surgery. Secondary surgery may be necessary to perform additional tightening or repositioning of body structures. Should complications occur, additional surgery or other treatments may be necessary. Even though risks and complications occur infrequently, the risks cited are associated with the surgery. Other complications and risks can occur but are less common. The practice of medicine and surgery is not an exact science. Although good results are expected, there's no guarantee or warranty expressed or implied on the results that may be obtained. In some situations, it may not be possible to achieve optimal results with a single surgical procedure. You and your surgeon will discuss the options available should additional surgery be advised. There may be additional costs and expenses for such additional procedures, including surgical fees, facility anesthesia, pathology, and lab testing. So again, we are going to do everything we can to give you the best possible results with the lowest risk of complications. That's what we do. But we can't guarantee anything, warranty anything, and we're not an insurance company. So if there's any fees not associated with our time and you need a revision or additional surgery, we can't pay for those for you. So I think that's an important thing to understand, that we're not an insurance company. For example, I had a patient after surgery. Surgery went fine. Everything went perfectly. Came in for a follow-up visit, and she was really short of breath. I was worried that she had a pulmonary embolism, of course, so we examined her. Her oxygen levels were a little bit low. She was clearly short of breath, so we sent her to the ER right away. Bunch of tests were done, didn't find anything wrong. No pulmonary embolism, nothing. She got CT scans, she got lab tests done, nothing was found. And she ended up being admitted to the hospital because she needed to be on oxygen for a couple days before she was safe to leave. And still, we have no idea why she was short of breath and needed oxygen, because every single test that was ran came back negative or normal. And she's fine now. But the point is her health insurance is going to pay for those expenses. Going to the ER, having those tests done, the hospitalization. I was seeing her every day and very involved with the whole process to make sure she was well taken care of, and everything that needed to be done was done, and everything that needed to be evaluated and looked for was looked for. And I, of course, am not going to charge her any extra or anything for my time involved, but we're not an insurance company, so her health insurance is going to pay for all those other costs associated with the hospitalization and the tests and the evaluations. And if she didn't have health insurance, then she would have to figure out and work it out with the hospital. So I just want to remind you again, we are not a health insurance company. So we can't, pay for all the costs that are associated with anything and everything that could happen. We will take care of you. There is no doubt about that. We will always take care of you, and we will not neglect you. And we're going to do everything we can to give you the best possible result with the lowest risk of complications, but we are not an insurance company. Patient compliance. Follow all physician instructions carefully. This is essential for the success of your outcome. It is important that the surgical incisions are not subjected to excessive force, swelling, abrasion, or motion during the time of healing. Personal and vocational activity needs to be restricted. Protective dressings and drains should not be removed unless instructed by your plastic surgeon. Successful postoperative function depends on both surgery and subsequent care. Physical activity that increases your pulse or heart rate may cause bruising, swelling, fluid accumulation, and the need for return to surgery. It is important that you participate in follow-up care, return for aftercare, and promote your recovery after surgery. So, just follow all of our instructions. Let us know if something doesn't make sense, if you're concerned, if you're worried about something. Follow up at all of your postoperative appointments so we can make sure everything's okay. And that is basically the gist of that paragraph. Attestation. So this comes down to smoking. Please tell us if you use any nicotine-containing substances. Sleep apnea. Please tell us if you use CPAP or have any history of obstructive sleep apnea. That's important for us to know. DVT-PE. Again, we're going to run you through a calculator. Everybody that gets surgery gets this calculation done to determine your risk of developing a DVT or PE, so we can minimize that risk while weighing it against the risk of bleeding if you're on blood thinners. So if you have any history of these things, a personal history of blood clots, a family history of blood clots, you're taking birth control pills, any hormones, a history of swollen legs, cancer, large dose vitamins, varicose veins, illnesses of the heart, liver, lung, GI tract, history of multiple spontaneous abortions or miscarriages, please let us know, because these things all are part of that calculation, and we're going to get the wrong calculation for you if we don't know any of these things. So please disclose all of these things to us so we can make sure we do the calculation accurately and we minimize your risk of a DVT or PE correctly. Early ambulation is important. SCDs, everybody gets those. And then anticoagulation depending on your level of risk. Communication, we have a separate consent for that. I hope you found this helpful. Please check out our website, restoreplasticsurgery.com. There you will find a price estimator that can estimate the cost of any combination of procedures that you might be interested in. You can also use our virtual consultation tool. It's essentially a way for you to send us your concerns along with photographs of your concerns, and we will respond with an assessment and our recommendations. On our blog page, there is a recording function called the Speak Pipe, and it's a place where you can leave audio recordings of your questions and things you would like discussed on a future episode. Finally, please follow us on Instagram and Facebook, And also check out our YouTube channel. Subscribe to the YouTube channel if you're watching this on YouTube right now. And lastly, we also have a podcast, Plastic Surgery Q&A, and you can subscribe to that podcast and listen to those episodes at iTunes or wherever you get your podcasts.